Cardiovascular system inspection. Technique. The evaluation of the cardiovascular system includes a thorough medical history, a detailed examination of the heart and the peripheral arterial and venous circulation, and appropriate laboratory studies. A careful assessment will enable the examiner to identify the etiologic, anatomic, and physiologic components of a specific cardiovascular disorder as well as to determine overall cardiac function. The examination involves inspection, palpation, and auscultation of the heart and vessels. What to observe during inspection? Skin, precordial bulging and chest deformity, apex beat, any other pulsations in the major precordial areas. Procedure. Introduce yourself and confirm the patient's identity. Ask for the patient's consent before beginning. Observe the patient as he or she first enters the room. Is there any breathlessness at rest or while walking? Begin inspecting the patient in a seated position, unsupported if possible, and undressed to the waist. If the patient is too ill to sit upright, support assistance may be necessary. Inspect the skin of the chest wall. Check for cyanosis, pallor, scars, wounds, bruises, lesions, nodules, superficial venous patterns or dilated veins. Observe the precordium and chest wall for any bulging or deformities such as scoliosis, kyphosis, or sternal depression. Identify if the apex beat is visible in the fifth intercostal space 1 cm internal to the mid-clavicular line. Next, look for visible left parasternal pulsation on the left lower half of the sternum. Look for visible pulsation on the second left pulmonary and second left aortic intercostal space. Look for suprasternal, root of the neck, and epigastric just below the xiphisternum pulsations also. Check for other pulsations over the chest wall. Finally, check for any abnormalities on the back such as spinal deformity. Physical findings must be interpreted in light of all previously collected data. The general scheme is to develop a postulate and test it with further history, additional observations or maneuvers on physical examinations and laboratory tests.